A lovely evening to you and welcome to Nationwide on the network service of the NTA. I am Ifoma Ojinta with the news. Now, the NCDC, that is the National Center for Disease Control, confirms 2 new cases of COVID-19, one in Lagos and one in Osun State, bringing the number of confirmed cases to 46. Meanwhile, a consignment of medical supplies and other protective equipment donated by Jack Ma, a co-founder of Alibaba, has arrived to the country. The consignment was received by the Nigerian Air Force on behalf of the Ministry of Health in Lagos. Lynn Leneke reports.
Medical supplies are part of intervention to assist the African continent to combat COVID-19, which is presently ravaging the world. The items received at the Murtala Mohammed International Airport, Lagos, was airlifted by the Nigerian Air Force. The critical medical supplies to the country in its efforts to protect its citizens was donated by Jack Ma Foundation. The target of the founder, Jack Ma, a philanthropic business magnate, is to assist 54 African countries to fight the virus. Since the confirmation of the first index case in Lagos in February, the federal government has increased surveillance and intensified public awareness. In Lagos, Lynn Leneke, NTA News.
Help has begun to come the way of Nigeria as the federal government took delivery of its first COVID-19 medical items from Jack Ma Foundation in China. Emmanuel Anyimiro is at the cargo section of the Nnamdi Azikiwe International Airport, Abuja, to tell us about the items.
The items landed in Lagos yesterday and evacuated to Abuja by the Nigerian Air Force C-130.
This consignment first landed in Addis, Ethiopia. He sent a whole cargo of aircraft for all the African regions. And our own beat is what we are seeing here. It's about 20,000 test kits, about 2,000 gowns, and about 100,000 masks that we are using.
That this virus is imported into the country and everyone coming in has had to pass through port health. It underscores the importance of the value of these items because the officers at the ports must be kept safe to be able to continue to do their work and keep the rest of Nigeria safe. So that makes it very important, and we appreciate these items that have been donated, and it will help us to do our job better and to keep ourselves safe and keep Nigerians safe.
We expect that more of such donation should come the way of Nigeria. Are we expecting any?
We have last 2 days we had a cause to meet with the members of United Nations system, and we have received several offers, and the task force is right now compiling a list which hopefully by the time they come to fruition they'll be made public to the Nigerian people.
We want to find out what is the compliance level. Yesterday the international flight was suspended in Abuja.
I want to confirm to you that we have provided all enabling environment for the port health to operate in Abuja Airport. And by 12 midnight, we are able to close Abuja Airport with the exit of Turkish Air, which departed to Istanbul with about 180 plus 3 passengers. So the airport is now closed up and all facilities that are in there are also available at the domestic terminal now. So if you go there, you will find people being screened by Port Health at the entrance and exit of the airport. So we want to ensure that all we could to make sure that this thing is checked at the airport.
This time of gesture from the Jack Ma Foundation in China and so many others that Nigerian is still expecting, it is expected that in a short time from now, Nigeria will be able to tackle coronavirus pandemic that has been ravaging the country.
Thank you very much, Emmanuel, for that update. In the meantime, it is well known that the weekly meeting of the Federal Executive Council did not hold this Wednesday. In fact, the highest policy decision-making body of the Nigerian government will not meet until further notice. But what is the situation in the nation's seat of government as a result of measures being taken to contain the coronavirus pandemic? State House correspondent Adamu Sambo is now standing by for an update. What can you tell us, Adamu?
Yes, studio. The Federal Executive Council meeting, usually held here in this hallowed chamber behind me, now under lock and key, did not take place this Wednesday. And as you have said, no one can tell when the next meeting will be held. The high-powered Presidential Task Force on COVID-19 announced the suspension of the Federal Executive Council meeting as a precautionary measure against the spread of the global pandemic. But what happens if any major decision is to be taken that requires the approval of the Council? This is the question I earlier asked the Special Advisor to the President on Media and Publicity, Femi Adesina. And this is what he had to say.
Yeah, the meeting of the Federal Executive Council was suspended because of the size. You have over 50 people seated in the council chambers whenever the meeting holds, and that is not advisable at a time like this. But if there will be a very important decision to be taken, you can always summon the relevant people, 3, 4, or 5, and hold a small meeting and arrive at a decision. It does not mean that one man is going to be taking all the decisions. Of course, yes, there are executive decisions, but the ones that must pass through consultation and which must have the buy-in of the Federal Executive Council can always be discussed at smaller meetings.
So how will you describe the situation in the State House at the moment regarding presidential activities?
Well, things are a bit on a low-key. It's not that the State House is shut down. It's just that it's on a low key, just like the rest of the country. The rest of the country is also on low key. There is partial lockdown in most parts of the country. So what is happening at the State House can also be called a partial lockdown, not a complete lockdown.
So is it true that a test was carried out on President Muhammadu Buhari on COVID-19?
Well, what did you hear about the result?
They say it's negative.
Good. So that calls for rejoicing with him. Anybody that does the test and tests negative, we rejoice with that person. And anybody that does it and tests positive, it's not a death sentence. We also would pray along with the person, give the person our goodwill and best wishes, and they will surely come out of it. Even the index case in Nigeria recovered and has been discharged. So God that has shown us mercy thus far will continue to show that mercy. Anybody that tests positive is not a death sentence. They will be attended to, they will be treated, and they will be fine.
There have been reports in the media that the presidency has banned some media houses from covering the president. How true is that?
Banned is a wrong word. Banned is a wrong word. Anybody that uses that word ban is just operating from a mindset. And you know that Nigerians love conspiracy theories. But this one is no conspiracy at all. And there is no ban.
So what really happened?
What happened is that in the press gallery, you have about 108 journalists in that single hall. And it goes contrary to the spirit of the times. The times dictate that you don't have too many people congregated in one place. Imagine 108 journalists, and if one of them happens to catch the virus, he spreads it among all the journalists. So we said, for now, let them stay away. Not much is happening for now. Let the journalists stay away, but we picked a certain number, representative of the media. They will come in. If there is anything, they will cover. And those outside will also not miss, because there will be a system in which they can share reports. So ban will be a wrong word. It will be operating from a mindset of conspiracy, and there's no conspiracy here at all.
So in situations like this, what other measures has the presidency taken towards containing the spread of COVID-19?
In the country generally, you mean?
In the State House.
In the State House. Of course, you know that when you come into the State House, you have about 3, 4, 5 spots in which your temperature is tested and you have to sanitize your hand. And if you come in and your temperature is way above a certain figure, then you will be advised to go for test and to take care of yourself. So I think so far so good. Before you get into the general area, you will meet about 3 areas of test. And before you get into the president's area, you meet like another 2. So I believe that a lot has been done to ensure that those who operate in the presidency are taken care of.
So is there a need for panic at times like this?
No, panic would not be the right thing to do. Because when you panic, you are bound to make mistakes. When you panic, you get agitated. And the situation does not call for that. Rather, it calls for cooperation with government. When they give instructions, let's abide with those instructions. And a number of things have been put in place to ensure that the well-being of Nigerians is taken care of.
The presidency, Nigeria's seat of government, is not taking anything to chance regarding COVID-19. There is now serious restrictions on visitors and the staff that have to come to work, as Mr. Adeshina said, are being thoroughly screened as a precautionary measure. Coronavirus, or COVID-19, as you might be aware, has no cure for now. So prevention is the key. And one important preventive measure is social distancing, or stay at home, has been encouraged by medical experts. Back to you in the studio.
Thank you very much, Adamu. Meanwhile, anxiety and fear in Bauchi as more people go into self-isolation. Mahmoud Ibn Mohammed is standing by with an update. Now, Mahmoud, can you tell us, what the reaction of the people of Bauchi was like yesterday after the governor tested positive to COVID-19?
Studio, there has been, a lot of reaction, prayers, and people keep lamenting on the issue. It's really a sad situation for the people of Bauchi because nobody expected, the COVID-19, at this moment, and especially from the #1 citizen of the state. But the situation has really reawakened the consciousness of the people of Bauchi. They are now more careful on the personal hygiene and issue of social distancing.
Okay, now what measures or further measures have been taken to contain the spread of the virus in the state?
The state government yesterday issued a statement calling on public servants in the state to stay at home. That's those from level 12 downward to stay at home only, except for those on essential duties. Then they also took sample of 27 people who were believed to have come in close contact with the governor, and all of them are currently on self-isolation.
Okay. Now, with the stay-at-home directive given, are people complying with it? What is the situation around the Bauchi state?
Well, for the state civil servants, most of them did not go to work. They did comply with the directive. But talking about business activity within the state capital, unlike the normal day before the announcement of the governor's test result, and the activities are on low key, but there are a couple of people here and there going about their normal activities.
Now, I hope the essential service providers are also, maintaining the personal hygiene in Bauchi to ensure that they don't contact the virus.
Well, to a large extent, there have been enlightenment programs all around, and institutions and organizations are really doing their best trying to, make sure that their staff are safe, regarding the issue.
Thank you very much, Mahmoud. I will also urge you to stay safe. Thank you very much. Now, following the number of contacts with a lot of persons during and after the burial of his mother, the Kogi State Governor Yahaya Bello and his close aides have embarked on self-isolation for 14 days as part of prescribed measures to curtail the chances of contracting and spreading the COVID-19. A statement by the Chief Press Secretary Onogu Mohammed states that this follows one of the prominent personalities that the governor had close contact with, whom was said to have been tested positive to COVID-19. The governor and his close aides have not shown any symptom of COVID-19 and are all in good health condition. Governor Bello called on all citizens to observe social distancing and high-level personal hygiene. The governor prayed and wished those that have tested positive to COVID-19 the Almighty Allah's healing balm and speedy recovery. Similarly, 7 persons have been placed on isolation in Niger State for COVID-19. The State Commissioner for Health, Dr. Mohammed Makun Sidi, who disclosed this in Mina, says they are under self-isolation. Suleiman Kodogi reports.
The State Commissioner for Health, Dr. Mohammed Makun Sidi, who disclosed this at a press briefing in Mina, said that out of the 7 people, 1 is in Suleja, while 6 others are receiving attention in Mina. He explained that the person in Suleja was exhibiting the symptoms of COVID-19, had to be isolated, while one of those in Mina just returned from the UK. The remaining 5 cases, the government said had contact with someone that has a confirmed case of coronavirus and have to be isolated too.
When this plane took off in the UK, when they were airbound, we already have information that some people are going to come into Niger. So we're even ready. We started tracing who are these people that are coming. And the moment they arrive, after passing the checks at the airport, we also follow them down to where they are. And again, by the arrival of that person to Niger yesterday by 9 a.m., within 1 hour or thereabout, we also got the information and we swung into action and we were in touch with NCDC and that person.
Meanwhile, a 28-man task force has been constituted on coronavirus with the Secretary to the State Government, Ahmed Ibrahim Matani, as head. In Mina, Suleiman Kodogi, NTA News.
Federal government has stopped all train movements across the country with immediate effect. A statement by the Managing Director, Nigerian Railway Corporation, Fidet Okiria, indicates that the move is part of the precautionary measures to check the spread of coronavirus in the country. And still on the coronavirus, while governments at all levels try to control the spread of coronavirus generally in Nigeria, residents of Uyo have expressed worry at the people entering into the state through land and water. Edidion Iba, who reports on situations at the motor parks, highlights the state government's plan at ensuring the safety of the people.
As at the time of this report, suspected cases of the coronavirus in Nigeria had risen to 36, with the first death recorded, according to the Nigerian Center for Disease Control, NCDC. Different measures have been put in place by various organizations to control the spread of the pandemic in Akwa Ibom State, as the government says they have put in place measures to curtail the virus should it get to the state.
We had set up a protocol to screen, detect early and act early if we find a patient that is suspected to have COVID-19.
At the Victor Atta International Airport, screening of passengers is an ongoing exercise. But however, what worries most residents of the state is the fact that persons who come in through the roads and waterways are not screened for the disease.
Checking people that are coming in from outside the states, no, we don't have the equipment, we don't have the facilities to do that for now.
If you go to any state in the country, there's no place that they are screening and cautioning the parks. There are many bush tracks and routes people are coming. Farmers go through those routes on motorcycles and keke. They don't pass the main road. So you really cannot screen all those routes.
While the government and its agencies try to ensure that COVID-19 is not allowed to spread in the state, it behoves on citizens to take responsibility for their health by being conscious and maintaining personal hygiene. In Uyo, Edidion Iba, NTA News.
It's now time to join Ruth in Lagos for more reports on Nationwide. Hello, Ruth.
Hello, Ifoma. It's good to see you. Most Nigerians are complying with the stay-home directives of the federal government as part of urgent measures to safeguard the lives of civil and public servants and Nigerians in general from the novel coronavirus. Lynn Leneke, who monitored the partial lockdown, reports.
It's a weekday and Lagos roads are devoid of the usual heavy traffic and gridlock. While most offices are closed, essential staff in specific offices reported for duty. At some major parks, the number of buses waiting to convey passengers were few. The passengers did not amount to a crowd. Tessie and Godwin are essential service workers whose services at a time like this is critical.
Even in the hospital, the influx of patients are reduced because many people are home. Some will come and not even want to stay that long and then, go home, unlike the way they usually come, feel relaxed.
I know a lot of people are not believing that it is real, but it is real.
While commending the initiative, respondents urged Nigerians to take the mandatory stay home seriously.
But I believe what the government said is a welcome development so to curb the spread of coronavirus.
I wouldn't advise somebody to be going at least at a long distance, mostly in a town that the index case has been pronounced.
The stay-home directive takes effect until further notice. In Lagos, Lane Lenake, NTA News.
Nigerians have been advised to desist from the use of chloroquine as a preventive measure against COVID-19 without medical advice to avoid any form of complications on their health. This advice was given by a medical consultant with the Federal Medical Center, Yaba, Lagos, Dr. Lanre Ajayi, while speaking with our correspondent, Thomas Ogbetere.
The advent of COVID-19 pandemic that has affected the economies of several countries negatively, Nigeria inclusive. Government of different countries no doubt have been trying their best possible to find lasting solution by way of researching for vaccines or drugs for the treatment of the disease. This has, however, also led to rumors and counter-rumors of different drugs said to possess the efficacy to cure the disease.
President Donald Trump, he made mention of chloroquine as part of drugs that has been approved to cure COVID-19. Nigerians, without doing much finding and much ado, they begin to take even without being confirmed positive.
The doctor advised us not to use it unless it is recommended by a medical expert.
A medical consultant in the Federal Medical Center, Yaba, Dr. Lanre Ajayi, was quick to let us into the source of the rumor that made many to indulge in such self-medication.
A small study was done, I think somewhere in France, where they tried hydroxychloroquine on some COVID patients, a very small study, and they felt that it helped. In the study as well, they also combined azithromycin with a hydroxychloroquine on some patients, and they felt they improved. But that's just what it is, a small study, which suggests that the use of the combination of these drugs might help.
Dr. Lanre, however, advised Nigerians on the dangers associated with indiscriminate use of chloroquine and other self-medications.
And what most people are buying here is actually chloroquine phosphate, which is actually a different molecule from hydroxychloroquine that was used in the study. So that's, for me as a doctor, nothing is ratified. It's not right for people to just go ahead and say they are buying chloroquine phosphate because they've heard that it works.
Dr. Lanre Ajayi also called on Nigerians to maintain a social distance from each other. In Lagos, Thomas Ogbetere, NTA News.
Time now for a break. The news continues with Ifoma in Abuja.
The coronavirus, also known as COVID-19, has been declared by the World Health Organization as a global pandemic. While clinical trials are ongoing for a vaccine and a possible cure, there is no known treatment for the coronavirus. Nigeria has recorded some of these cases, and people are advised to take these preventive measures to keep themselves safe and contain the further spread of the virus. Wash your hands frequently with soap and water or use hand sanitizers all the time. Maintain social distancing. Avoid touching your eyes, nose, and mouth. Practice respiratory hygiene. If you have fever, cough, and difficulty breathing, seek medical care early. Do not panic. Stop the spread of unconfirmed news. Follow the official government news outlets and report all cases immediately. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
The attention of the Nigeria Social Insurance Trust Fund has been drawn to activities of some unscrupulous fraudsters who have been using the fund's name, logo, and also photographs of events of the fund to defraud unsuspecting members of the public. We reiterate that the Nigeria Social Insurance Trust Fund does not demand to double money under any guise. NSITF is charged with the implementation of the Employees Compensation Act 2010, which enables compensation in the event of death, injury, disease, or disabilities arising out of or in the course of employment. Individuals, groups, or organizations that transact business with sponsors of such scams do so at their own risk. For more information, please visit our website on www.nsitf.gov.ng or call us on telephone number. Management Announcer.
Illegal oil refineries are devastating. Crude oil theft is criminal. Oil spill due to vandalism is dehumanizing. Piracy is inimical to the economy and international trade. From the creeks of the Niger Delta to the Atlantic Ocean, inland waterways and beyond, the activities of criminally minded Nigerians and their foreign collaborators have hampered Nigerian economic growth, constituted health hazards, and environmental degradation. The Nigerian Navy is poised to put a stop to these activities. Remember, the harmonized standard operating procedure in the maritime sector for optimal benefits of the nation's economy is fully operational. The Nigerian Navy will leave no stone unturned to ensure defaulters face the full wrath of the law. Ignorance of the law is no excuse. Be one. Support the Nigerian Navy. Onward together.
Nigerians, coronavirus is dangerous. It can kill. When you see this sign, high fever, cough, shortness of breath, drowsiness, pneumonia, don't panic, don't hide, don't embark in self-medication. Promptly visit the nearest medical facility. Report all cases to the nearest hospital. Prevention is key. Avoid contact with infected persons. Avoid crowded areas as much as possible. Wash your hands regularly. Use hand sanitizers. Your life is precious. Stay alive. Live long, live right. This message is sponsored by the Federal Ministry of Information and Culture and the Nigerian Film Corporation. Nigerian Film Corporation, powering possibility.
You're welcome back. The Imo State's government has procured hand sanitizers to be distributed to various agencies of government and individuals as a means of checking COVID-19 infection in the state. Bright Ebuchu reports that the sanitizers were handed over to the Ministry of Health by Governor Hope Uzodinma for onward distribution free for the people.
Governor Uzodinma, while flagging of the distribution of hand sanitizers in Imo State, directed the closure of nightclubs and late-night restaurants, while also directing civil servants within the age bracket of 40 and above to stay at home.
Coronavirus is real. It's very dreaded. So the rate with which the thing is spreading across the country and the globe is very alarming now. So we must be very vigilant. We must also guide against anything that will encourage this disease coming into Imo State.
Director of Ministry of Health, Dr. Daniel John, assured the governor that the hand sanitizers will be judiciously distributed.
This is the first time we are seeing this type of magnanimity, and it is under your government that Imo State was privileged to have an isolation center.
The procurement of hand sanitizers by the Imo State government is in commitment to the prevention of coronavirus in the state. In Owerri, Bright Ibuchu, NTA News.
Now joining me in the studio to discuss the effectiveness of hand sanitizers and face masks, as well as other preventive measures, is a public health physician. He's Dr. Damian Bai. Doctor, you're welcome to our studios.
Thank you very much.
Now let's start by asking you who can use hand sanitizers and face masks.
Well, it is for everybody. But what the World Health Organization advocates, it's that we should use soap and running water to wash our hands as frequently as possible. And the contact time for the washing of hands should be at least 20 seconds. If you do not have access to soap and running water, then you're supposed to use a sanitizer. Now, not just any sanitizer. We expect that you'll use a sanitizer that has a minimum of 70% alcohol, because it is the alcohol in the sanitizer that destroys the virus.
Now, talking about alcohol in the sanitizers, a lot of people are now going to take alcohol, especially local gin, the one we popularly call ogogoro and other stuff. They actually take it and put some in the sanitizers. Some of them even use it as hand sanitizers. So what's your take on this?
Well, drinking it will not help them, because by the time they are drinking it, the virus is already inside them, would have attached to the cells, and is late. But when you use it topically, that's using the hand sanitizers on your hands, you are destroying the virus before it gets into you. Yeah. So drinking ogogoro will not help any person at this point in time.
Okay, now we have so many hand sanitizers everywhere, as well as face mask. How do we know which is the real thing?
We want to believe that people who make these hand sanitizers will label the hand sanitizers properly. Now, if it is labeled properly and you see at least 70% alcohol on the label, then we say it's good to go. Unfortunately, some of the sanitizers we've been seeing do not have the percentage of alcohol in it. So we're not sure whether that sanitizer has up to 70% or not. That is why we advocate that we should wash our hands regularly with soap and running water, and use the sanitizer only when we don't have access to soap and running water. Okay. That way we'll be taking care of the issue of the sanitizer not having enough alcohol in it. Okay, now in using the face masks, what should we look out for? Well, the first thing in using a face mask is we have to use it and know how to use it properly. Now, there are basically two types of face masks, as you can see. This is a surgical face mask, and this is called the N95 respirator. Now, there are two different types, but both can be used. Now, in using this face mask, you have to use it properly. What do I mean by using it properly? Before you put a face mask on, you must make sure that your hands are clean. So you either wash your hands with soap and running water, or you use an alcohol-based sanitizer, as we have said. Once you have done that, then this, for instance, has two sides. There is a white side and a blue side. You pick the face mask using the attachments here. The white side faces you, and then you put it on. But before you put it on, you must look. There's a metallic strip on top. Okay. This metallic strip has to be facing upwards, because you're going to use it to hold your nose. Let me demonstrate as this is done. You do this. It's at the back of your ears. You use this to hold, and you pull this down so that your mouth and nose well covered. Now, if you want to take out this face mask, you must hold it here, pull it out, and then dispose of it in a sealed bin.
Okay.
And then you wash your hands. Now, while you're using the face mask, people will ask, how long do you need to use a face mask? Now, it is advised that you don't use it for more than 8 hours. However, at any point in time, if the face mask is soiled or becomes dampened, you are supposed to remove and discard.
Okay, doctor, I just want to ask you something. What about people, when they have the face mask on and they want to talk or cough or sneeze, they actually bring it down and do their thing, then put it back up. Is that proper?
That is actually wrong. That is actually wrong, because the aim of putting a face mask is to protect you from getting in contact with these organisms if someone close to you has. It also to protect the next person. In case you have, you also protect the next person. So I've seen people even want to cough, and they pull the face mask down and cough. That defeats the aim of the face mask. So that is not correct.
Okay, now what's finally at this time where we have this issue, what advice do you have for Nigerians concerning our present situation?
I think the first advice I'll give to Nigerians is that they should not panic. There is no room for panic. If they just follow what the World Health Organization is saying, what the health professionals are saying, since the virus has no known cure or vaccine for now, the best way is to prevent and protect yourself. How do you need to do this? We've talked about washing our hands with soap and running water as frequently as possible. We've talked about social distancing so that you are not crowded up in a place. As we're sitting now, this is quite good. Okay. We expect that the distance should be at least 1.5 to 2 meters. And also, once you touch surfaces, please do not touch your face. Yes. That is why we advise that if you're going to be opening doors and all that, use the non-dominant hand, because the tendency is that, for instance, what I mean by non-dominant hand is if you're right-handed, the non-dominant hand is the left hand. So use the left hand to open doors, to touch surfaces, because it is unlikely that you want to wipe your face as a right-handed man and use your left hand. So this is our advice. Do not panic. All is well.
That will be all, Doctor. Thank you so very much for sharing your thoughts with us. Thank you.
You're welcome.
Now it's time to join Mina in our Enugu Network Center for more on COVID-19. Hello, Mina.
Hello, Ifoma. Good afternoon and welcome to Enugu. Public servants in Enugu State, except some essential service providers, are till further notice work from home, while all cultural and social functions have been suspended till further notice. These are part of stringent measures announced by the State Governor Ifeanyi Ugwuanyi as additional steps being taken against the spread of the novel coronavirus in the state. Susan Eze has details.
Though Enugu State has yet no record of the rampaging coronavirus in the state government has in the past weeks taken some proactive measures, including the release of 330 million naira to strengthen the coronavirus disease preparedness and response. In view of the escalating threat by the disease, government has taken some additional safety measures.
Closure of all educational institutions in the state. All public officers, civil servants to work from home till further notice, except the following: the health workers, forest guards, neighborhood watch personnel, water corporation staffs, waste management operatives, and hedge. All those involved in other essential services. Suspension of all cultural and social gathering.
While advising that the social distance protocol be strictly adhered to, the governor directed local government authorities to sustain aggressive public enlightenment campaign on the situation.
All public transport operators in the state are to observe the following rules on passenger conveyance in each instance. A. Keke, not more than 2 passengers. B. Commuter buses, not more than 2 passengers per seat. C. City car, not more than 3 passengers.
Law enforcement agencies, he said, are to enforce strict compliance to these guidelines, while government remains committed to the safety of the people. In Enugu, Susan Eze, NTA News.
Meanwhile, Enugu State residents have quickly adjusted to the stringent directives given by the state government by imbibing some preventive measures in total compliance to the safety directives against the novel coronavirus. Correspondents went to town to monitor the level of compliance. In compliance to directives on increased personal hygiene, some institutions, banks, private business premises, and eateries have already put modalities in place by installing water dispensers, liquid wash, hand wash, and hand sanitizers at the entrance of their premises.
We have commissioned our officers to go to the field and make sure that these laws, as given by the state governments, are implemented to the letter.
The total shutdown directive of the Enugu State workforce, schools at all levels, and restriction orders on social gatherings are all geared towards ensuring the social distancing protocol is strictly adhered to. Some residents on essential duties and individual businessmen were seen putting on nose masks, hand gloves, and armed with hand sanitizers to stay safe.
Well, where you live now.
Well, what Mr. George just said now is that he heard rumors that there is a disease in the air called coronavirus, and because he interacts with people by the nature of his job, he touches people's footwears, exchanges handshakes and whatever with his customers. He decided to stay protected.
I meet with many people, the pharmacists, medical doctors, and rest of them. So I visit public areas. So I have to protect myself.
Apart from the earlier suspected COVID-19 incident in Enugu State, which turned negative, there's not been any recorded incident of COVID-19. It is hoped that with the level of compliance to safety measures as already put in place, it will go a long way to keep residents safe from COVID-19. And that does it from Enugu. It's back to Ifoma for a continuation of Nationwide.
Thank you very much, Mina. And as the Nigerian government continues to take series of measures in curbing the spread of coronavirus in Nigeria, stakeholders have welcomed the partial lockdown order, even as security operatives express readiness to ensure strict compliance. Guests on NTA's program Good Morning Nigeria made these submissions while discussing the subjects: COVID-19, coping with isolation and lockdown. Olusheye Adiagbo has details.
We basically asked the chapter chairs to take a survey of all Nigerians in that particular country through also that hotlines to report exactly the cases we have. So far, we have one case in Italy. A Nigerian has been quarantined. We had is responding very well, and also one in Portugal.
Ken Gandhi, chairman Nigerians in Diaspora Organization via Skype from Germany, shared some of the experiences of Nigerians in several European countries currently under lockdown. He said they are coping well with the situation, with only 2 Nigerians confirmed to be positive of the virus as at the last count. The guest commended the efforts of the Nigerian government at all levels in the face of lack of adequate health facilities. They called for massive enlightenment on isolation and potential lockdown situation, which they say must be all-inclusive.
Government needs to incorporate this in part of the strategies. The groups that are set up to implement these decisions, they need to include psychologists in particular to help in this process.
On the state of security during the stay-at-home order, Force Public Relations Officer DSP Frank Umba and Deputy National PRO, Nigeria Security and Civil Defense Corps, DCC Shola Odumosun, say their mandate is to support strict compliance of every order given by the government.
Where anyone or group of persons remain recalcitrant and is out to disobey these restriction orders, we will be out there to enforce them.
Nigerians who reacted via NTA GMN Twitter handle commended the media outfits across the country, especially the NTA, for prompt information dissemination on COVID-19 preventive measures. In Abuja, Olusheye Adiagbo, NTA News.
Still on health matters, the Nigerian Army and Army Officers' Wives Association are upgrading a new modular general hospital to support the containment of COVID-19 in Nigeria. Located in Asokoro along Defense Intelligence Agency Road, the facility was conceived in 2017 by the Nigerian Army Officers' Wives Association, NAOA, to complement the services of other military hospitals by providing secondary and specialized tertiary health care. The hospital, with the capacity for cancer screening, radiology with digital X-ray, ultrasonography, mammography services, and lifestyle medicine clinic, is open to both military and civilian alike. The Chief Medical Director, Army Command and Naowa Hospital, Major General Ikechukwu Okeke, who conducted the Chief of Army Staff, Lieutenant General Tukuburatai, around the center, notes that the hospital will liaise with the Nigerian Center for Disease Control to ensure necessary guidelines in the prevention and care for COVID-19. In the meantime, the Nigerian Baptist Convention has announced the postponement of its annual convention, which usually attracts thousands of delegates nationwide following the coronavirus outbreak in the world. The rotational convention was earlier scheduled to hold at the Baptist International Center along Lagos-Ibadan Expressway from April 18th to 23rd, 2020. The Nigerian Baptist Convention President, Reverend Olasupo Ayokunle, who also doubles as the President of the Christian Association of Nigeria, in a memo to all Baptist churches and affiliate organizations, said the postponement of the convention was in strict compliance with the ban on social and religious gatherings by not only Lagos but various sub-national governments. He also urged members of the Baptist Convention to follow laid-down precautions and advisories by all tiers of government to contain the coronavirus pandemic. Sokoto is our next stop on Nationwide, and Sadia will give us an update from that zone. It's over to you, Sadia.
Thank you, Ifoma. The compulsory stay at home for non-essential federal public servants on grade level 12 and below as a measure to curtail spread of COVID-19 has taken effect in Sokoto. Sheikh Muhammad Detti reports that the Nigerian police has also launched a sensitization campaign on coronavirus. The report.
This is the Federal Secretariat complex in Sokoto, housing many federal government agencies and parastatals. The complex is devoid of its usual hustle and bustle. While compiling this report, NTA News visited the Code of Conduct Bureau Office, National Agency for Food and Drugs Administration and Control, NAFDAC, Pest Control Office, among others, and only officers above grade level 12 were on seats in compliance with the federal government directives of stay at home.
As you can see, the other level of 14 officers just came. He will attend to them. They will bring whatever is it, the file or the forms himself. If I treat, if it's not nearby, I'll take it. I will do it myself.
But if you go to the offices, you will discover that the offices are deserted.
However, federal government workers on essential duties were on ground to render their services. Staff of Federal Fire Service, Nigeria Security and Civil Defense Corps, and the media were on duty.
So we are always ready to serve the humanity.
And I just want to add the citizens of the country that we want to know that the police are not out for them to prevent crime and protect the law-abiding citizens.
Nigerian Police, Sokoto Command, also joined the campaign to sensitize its members on preventive measures against COVID-19. In Sokoto, Sheikh Muhammad Detti, NTA News.
Zamfara state government is to enforce the ban of gathering of more than 20 people and ensure closure of Al-Majri and Islamia schools to guard against the spread of COVID-19. The State Commissioner of Police, Usman Nabogo, stated this at a press briefing in Gusau. Sadia Abubakar has the story.
The Zamfara State Police Command resolved to ensure full enforcement of the ban on public gathering and the directive on the immediate closure of Arabic and Islamia schools followed the recent pronouncements by the state government to that effect.
I've also procured testing kit for distribution in our motor parks in order to test passengers arriving in the state from other locations.
Area commanders and DPOs are directed to work hand in hand with their local government chairmen and other security agencies of their respective areas to ensure that any gathering of more than 20 people is banned until further notice.
All the police area commands, divisional offices and units across the state have been directed to fully comply with the directives of the Inspector General of Police, Mohammed Adamu, on social distancing and all other measures put in place to guard against the spread of the coronavirus.
I have also directed my area commanders, DPOs, and other investigation unit commanders to decongest their detention facilities except high-profile criminals.
In the meantime, the Zamfara State Police Command has paraded some 11 suspected notorious criminals recently arrested in various parts of the state. In Gusau, Sadia Abubakar, NTA News.
That's it from here. Nationwide will continue after this break.
I'm Deputy Comptroller of Customs Joseph Atta, the spokesman for the joint security exercise. Over a period of time, either through indifference or deliberate non-compliance to the ECOWAS protocol on transit of goods by our neighbors, the Nigerian Customs Service have been raising this issue. MOUs were signed severally. They were broken as soon as they were signed. We've seized over 32,050 kg bags of rice, and that is a huge impact. And then the fact that the coming in of this foreign rice have been completely shut down. We've gone around, we've received testimonies of farmers who, before now, found it difficult to sell one truck on a market day. These people say it now that those who could not sell one can now sell up to 20 trucks.
We have 4 girls and 2 boys. Stephen is my younger brother. I was called on 8th of May that he had an accident. While he was on call, he came out to buy fruit that will sustain him to the next morning.
Touching lives.
Have you not heard of coronavirus?
Coronavirus?
Yes, COVID-19. You know prevention is better than cure. Always have your hand sanitizer with you. Always remember to wash your hands regularly with soap and clean water. Yes. Whenever you want to sneeze or cough, you do it like this. Let's go. Fellow Nigerians, our culture encourages cleanliness. Let's ceremony.
This message is from NTA and NCAC.
And our next port of call on Nationwide is Benin. Agatha is our guide.
Thank you, Ifoma. A warm welcome to Benin. Edo State government has confirmed that Speaker of the State House of Assembly, Frank Okiye, is the index case of COVID-19 in the state. Deputy Governor Philip Shaibu, who disclosed this to journalists, also said that Governor Godwin Obaseki has gone into self-isolation following close contact with confirmed cases. Goodluck Enaini reports.
Mr. Shaibu told journalists that the governor has sent his sample for testing. He explained that the governor is not showing any symptom of the virus, but has taken necessary precautions.
The governor of Edo State, Mr. Godwin Obaseki, has gone into self-isolation following the close contact with the Bauchi State Governor, Senator Bala Mohammed, and Chief of Staff to the President, Abba Kyari. The index case of coronavirus in Edo State is the Speaker of Edo State House of Assembly, Right Honorable Frank Okiye. He traveled to the United Kingdom. He came back and went into self-isolation.
The state government is contemplating a total lockdown. It has also reeled out more measures to curb spread of the virus, reducing the number of persons at any gathering from 50 to 20. Except for sellers of foodstuff and other essential commodities, all markets in Edo have been closed to other category of traders.
I've ordered the law enforcement agency to enforce the ban on public gathering.
The 35-member COVID-19 response committee inaugurated by the governor will continue to review the situation in the state and step up measures to contain the spread of the virus. In Benin, Goodluck Enaini, NT News.
That's it from here. Former, it's back to you.
Many thanks, Agatha. And this is Sports Brief.
Despite the closure of the main bowl of the Mohammed Diko Stadium in Katsina,